Hey there, and welcome to another Chairside Chat with me, Michelle Strange. This week brought to you by EMS. If you've been following along in my GBT or Guided Biofilm series, then you know we're up to steps 7 and 8 of the 8-step program. So to quickly recap, we have completed step 1, assessment. Step 2, disclosing the patient. Step 3, motivating the patient, which is one of the most critical steps in GBT. Step 4, we get to use the airflow unit and get after that biofilm. And then in step 5, if the patient needs it, we can use the PerioFlow device, which takes the erythritol powder deeper into the periodontal pocket. And then in step 6, we use the Piezon ultrasonic handpiece for any remaining hard deposit. We get that off with this guy. And now we are completing our GPT steps with step 7, which is check your work, and step 8, which is scheduling a recall. So step 7 is going to give you probably some PTSD from hygiene school. I will be candid. We're going to check around and see if we can spot the remaining disclosing solution or calculus. Is that bringing back memories? Because we have removed biofilm and the hard deposit, so now we can accurately diagnose carious lesions and fractures. We can discuss any other concerns that we have noticed, oral lesions, airway issues. This is when I like to recap some of the info I discussed when we're chatting about home care. I want to write this down or use any of the apps on my phone to send the patient product recommendations, and then I go call the doctor in for an exam. And last but not least, I schedule the recall based on their needs and their level of oral health. And I think we all know that the 2 times a year schedule is some arbitrary number that's not based on the needs of our patients. So we schedule accordingly to what the patient needs. And the patient is loving life because the treatment's done in the least invasive way with the highest comfort, and they leave with that fresh, clean feeling too. And I know I've said this before and I want to repeat it. I love how these appointments flow with GBT and the airflow prophylaxis master. I love that I tell my patients and anyone who listens that I practice GBT. It's a paradigm shift in our approach to patient treatment that's long overdue, in my opinion. And you can learn more about Guided Biofilm Therapy at ems-dental.com. And if you're excited about GBT and you're enjoying Chairside Chat, please go ahead and smash that heart button and send us that like or drop us a comment. Thanks, y'all.